am teaching the medical students and other emerging leaders is the new world for these caregivers is that they are going to have algorithms running all the time. In the past, a lot of medical education was centered around teaching diagnostic reasoning. There was a lot of emphasis placed upon developing your differential diagnosis and these hard-earned skills. And now we're going to be in a system where we need to teach the physicians and nurses and other health professions of the future how to think skeptically about AI, because those differential diagnoses and those alerts are going to be running all the time. One thing I'm going to say is going to be, my first point is going to be probably controversial. I'm not a big fan of dedicated AI governance per se. It's very tempting to do that. And maybe there does need to be kind of a vetting committee that does have that AI expertise. But I think that a lot of these decisions have to be driven based around delivery of care to the patient and what we often will call the triple aim, delivering the best quality care with the best patient experience and the best value, lowering the cost of care. So that's a tried and true model. And I think that when we think that, and the whole point of AI is that it should be delivering on that, right? AI does promise that idea that we can deliver great care quicker and at a lower cost. Otherwise, you shouldn't really be looking at the solution, in my mind. Try to go to where don't set up separate committees and try to get doctors to attend. Try to find out where they're meeting, get on their staff meetings, go to med staff, try to sort of socialize your ideas and look for volunteers by kind of, crashing their meetings and just getting a 10 to 15 minute point on the agenda to explain what's going on. Those are two of the top things really around governance and building a coalition. In order to be effective in leading organizations and using AI or implementing AI, having a bit of sort of statistical literacy is helpful. And there are entire wonderful healthcare disciplines where that was not beaten into their heads early in their career. So I think I'm going to see that as a core competency. As the AI is doing more and more of the heavy lifting, you need to now be able to focus on that discernment and try to, be able to reverse engineer a little bit. Why is the AI saying this? Why is it conflicting with what I'm thinking? So those would be the parting things, is the leaders of the future will have invested in getting a certain degree of data literacy, and that no healthcare field is going to be exempt from that.